So here we are, the ultimate assessment guide. And like I said, this is basically taking all the data that we have right now and combining the symptoms plus the labs and coming up with a way to assess. So I'm going to read the kind of the instructions here, and then we're going to go through it so that you can have an idea about what it is. Make it easier on you when you print it out. So this document was created to help you identify which causes of fatigue you have based on your symptoms and lab data. I've placed an asterisk by those symptoms that are the most significant indicators of that particular cause. You will find that the assessment is always based on a combination of all the data available, but certain causes rely more on the symptoms present, while others rely more on the laboratory data. And I'm going to note that below so that it'll make it easier for you. So here's the how-to. So the first thing that we're going to do is we're going to check off all of the symptoms that we have. Then we're going to mark off the laboratory tests that we have done. And it tells you exactly which laboratory tests to do. I've got the website here of where to go to order the lab tests, and that's where you'll find all of them except for this Lyme PCR panel, the DNA connections test, and I've got the link there. You can go order that. And then next, third, when you have the results back from the lab, or if you already have your results, then you mark off the laboratory data that you have. Then you read the education section, which kind of pulls it all together and helps you decide whether or not you have that cause. And then last, I've got a conclusion section where basically you mark off, yes, you have the cause, no, you don't have the cause, and then you put it back on the big causes of fatigue checklist, which I will show you in a second. And then, of course, if you ever have any questions, here's where you can submit them and the links. And of course, as always, all the content that I produce is for educational purposes only and is not meant to diagnose and treat. So this is the list of the causes of fatigue. And so what I've done is I've grouped them into deficiencies as well as into toxicities. And we're going to go through all of these. And what I've done, you'll see the pluses and the minuses next to them, is that I've given you some guidance on assessment is based more on signs and symptoms and confirmed with labs. So this is if you don't have the lab yet and you still want to dive into this packet, you can do so by going after the ones that are based, focusing mainly on those that have the plus next to them, which are mainly the ones that you can diagnose based off of your signs and symptoms. So adrenals, mitochondria, thyroid, estrogen, progesterone deficiency, testosterone, sleep deficiency, water, good food deficiency, neurotransmitters, movement, exercise. And then over here under toxicities, constipation, stealth infections, all these stealth infections, sinus infections, food allergies, inhaled allergies, negative emotions, and EMFs. So those are all kind of subjective experience. The minus is based more on laboratory tests and then confirmed with the symptoms. So this is the nutrients, so B12, folate, vitamin D, magnesium, iron, and then we're looking over here at molds, heavy metals, chemicals, intestinal infections, and that's it. And then assessment based on both equally. So that's dental infections because they're very hard to find. And so they're based both on subjective as well as the objective. And all of these things really are based on both of those. But I wanted to kind of give you this, to give you that distinction between those so that you could really have an idea about if you have the labs or if you don't have the labs, where you want to focus your attention. So hopefully that's helpful. This is also the list where once you go through the process for each one of these causes below, then you come back up and let's say you got adrenals, you can mark it on this page. So this is kind of like your main page, because then when we go into the plan, step 2 through 4, right, replacing the deficiencies, opening up detoxification pathways, and then removing the toxicities, we're going to look at these causes so that we know where to focus. Because if you don't have the thyroid deficiency, you don't need the plan for how to fix your thyroid, right? So hopefully that makes sense. Let's see if I can remove this. There we go. Okay. So let's dive in here. So deficiencies, adrenal deficiencies. So mark off all the symptoms that you have. So difficulty being out of bed for more than a few hours a day, feeling tired regardless of the length of time you sleep, feeling unusually tired in the mornings and in the afternoons around 3 p.m. That's usually when people have crashes. You need a cup of coffee to get moving in the morning. If your blood pressure is low, so basically your top number, your systolic number is less than 110. If you have symptoms of orthostatic hypotension, which is basically dizziness or lightheadedness when you go from lying down or sitting to a standing position rather quickly, and that's because the blood pressure is too low. If you have a craving for sweets and or salty foods, so pretty much this is potato chips, is kind of people say they can't walk by a bag of potato chips without having to stop. And this is because of the adrenal glands' effect on insulin, blood sugar, as well as salt balance. So sleep problems, this is a hard time falling asleep, a hard time staying asleep, lack of interest in sex or low libido, poor memory or brain fog, increased inflammation and pain because adrenal gland produces cortisol, which is our body's main anti-inflammatory. Increased, I did that one, weight gain, especially around the middle. You get every cold and flu bug going around, or I should also note that you never get sick at all. A feeling of overwhelm for tasks that you used to be able to handle easily. The overwhelm is a very big marker. An improvement in your symptoms when you're on vacation. A second wind if you stay up after 10 p.m. So usually your circadian rhythm is very disrupted, your sleep-wake cycle. So after 10 o'clock at night, if you miss your window, 10:30, all of a sudden you're like 11, oh my gosh, I have all this energy, now I can clean the house. So that is also a sign. And then post-exertion malaise, so this is basically fatigue after you exert yourself, is also a sign because exercise can be stressful on the body. It's very helpful in so many ways, but it can be stressful and it can be hard on the adrenals. So if you feel worse after exercise, that is a sign that your adrenals are not compensating appropriately. So here's that next section. So you mark off all of those symptoms. Here's that next section, laboratory tests to do. So either the Fix Your Fatigue blood panel that's on that page, or the male or female hormone panel, which is that blood spot. You know, if you're male, do the male panel. If you're female, do the female one. And that's going to give you your adrenal data. And so you check off whichever one you've done once you've done it. And then this is the laboratory data interpretation. So if you've got a cortisol level, morning cortisol level before 9 a.m. of less than 15, and then you mark this box. If you have DHEA less than 150 in women or less than 300 in men, you mark this box. And then if you have elevated blood sugars on blood testing, you mark this box. Now, if you've got a perfect diet and you have elevated blood sugar on blood testing, oftentimes that's a greater indicator than eating a lot of McDonald's and having elevated blood sugars. We're talking about, you know, there's no reason why you should have elevated blood sugars. So it's got to be something physiologic, something that's going on inside the body. It's not from the foods that you're taking in. So then here's the education section. So in my experience, it is very likely that someone has adrenal deficiency if they have 5 or more of the above symptoms. This can be corroborated by a cortisol level less than 15 and DHEA sulfate level of less than 150 in women and 300 in men. These levels may be falsely elevated during times of stress or if other hormones are deficient, so they may appear better than they are, which we will go into when we get into the plan. Since cortisol manages insulin, elevated blood sugar levels can also be seen. And in general, I have found that everyone with fatigue requires adrenal support. So that kind of helps you with my thinking. And then based off of that and the information that you've gathered in these sections, you can make the determination, yes, I believe I have this cause, or no, I do not I believe I have this cause. So if it's yes, I believe I have this cause based on the symptoms and laboratory data, I'm going to check this off here. it's going to let me. It's not going to let me. And say, now add this cause to the causes of fatigue page. So now I go back up to that second page. Here we are. And I'm going to check off the adrenals. And then I go on to the next page. So the next one is mitochondrial deficiency. So hopefully that makes sense. This thought pattern where you're able to go through this and understand my thinking and how I do this sort of assessment, basically combining all the data that we have available, the subjective experience with the symptoms, the objective data with signs and laboratory data, and putting those together to determine whether or not someone has a cause. Because as you guys know, in order to resolve fatigue and achieve amazing energy, you have to find all of the causes. Because it's only after you find all the causes that then you can treat all of the causes and really see that difference. So with mitochondrial dysfunction, once again, mark all the symptoms that you have: fatigue, loss of motor control, balance, and coordination, muscle aches, weakness and pains, digestive problems and gastrointestinal disorders, cardiovascular problems and heart disease. So as you guys may know, mitochondria is the energy center of every cell in the body, and it's in every cell except for red blood cells. But so many of our organs have mitochondria in them. Adrenals, the heart muscle, muscles themselves. So if you're looking, every single one of these things, brain, muscles, this is all basically referring to the organ that has the mitochondria in it. Digestion, so the intestines have a lot of mitochondria. The heart, the pancreas, blood sugar irregularities, hormonal disorders, so the adrenal gland, thyroid hormone, sex hormones. A lot of people, I shouldn't say a lot, but there are some people out there who believe that what some people are calling adrenal deficiency or adrenal fatigue is actually mitochondrial deficiency of the adrenal gland, where the adrenal gland is just not functioning right because the mitochondria are lacking in the gland. Vision loss and other visual problems, so that's mitochondria in the eye and also in the brain. Higher susceptibility to infection, that has to do with its relationship to the immune system. So then the laboratory test to do is the optimal nutrition evaluation, the ONE or the ONE test in urine. And then the levels that you may see will be low glutathione levels, low CoQ10 levels, high levels of lipid peroxidases, or high levels of 8-hydroxy-2-deoxyguanosine. And then I say, in my experience, it's very likely that someone has mitochondrial dysfunction if they have 2 or more of the above symptoms. This can be corroborated by the laboratory data listed, but is not required. So if you have 2 of these, let's say you have fatigue and you have digestive problems, you most likely have mitochondrial dysfunction. And I also say, in general, I have found that everyone with fatigue requires mitochondrial support. It's incredibly important. So then once again, you would mark off yes if you had this, which I believe most of you do. And then we would scroll back up to that page 2, which when you print it out, you're going to have it right next to you as you go through it, and you'll be able to mark that off as you go through this packet. So next up is thyroid deficiency. So marking all the symptoms that you have. So, and you'll see on some of these, I've got them asterisked because these are actually especially significant. As I mentioned on that first page with the instructions, ones with asterisks are especially significant. So for thyroid, these are the symptoms: fatigue, cold extremities, so cold hands, cold feet, memory loss, hair loss, lower leg swelling, constipation, dry skin and hair, brittle nails, weight gain or difficulty losing weight. And then there's some lab work on here: elevated blood sugar or diabetes, elevated cholesterol, elevated blood pressure, depression and anxiety, heart palpitations or arrhythmias, poor cognition or brain fog. So those are signs and symptoms. And then the laboratory test to do to evaluate the thyroid is the FYF blood panel, or the male or female hormone panel, which is that blood spot test. And just as an aside, the way that this works is that once you purchase it from my partner's site, then you will get a lab order if it is the blood test, and you print that order out. It comes to your email, you print it out, and then you take that and you go to your nearest lab. LabCorp or Quest are some of the big ones. And then the male-female hormone panel, the blood spot test, that one comes in the mail as a kit. You basically just prick your finger and do the test that way. So, and then here's the results. So the laboratory data is a thyroid level, a TSH level of greater than 1.5, and then a free T4 level of less than 1.2, a free T3 level of of less than 3.0. And we'll go more into these when we do more education on these individual sections. But once you have this packet, then when I go through more of the training, you're going to understand more about how all of these different causes work together, and more about the background and more details on some of the nuances to the laboratory data. And then thyroid antibodies elevated per reference range of the lab, and then elevated cholesterol and other cardiovascular markers on blood testing. As if you've heard me speak before about thyroid, the number one anti-hypertensive, so basically blood pressure lowering medication, as well as cholesterol lowering medication that I have found is thyroid. And then blood sugars will also come down when you optimize thyroid function. So blood sugars will be elevated. Heart strain markers, so a precursor to congestive heart failure, will be greatly improved by optimizing thyroid. And then elevated inflammatory markers on blood testing as well. So then here's education. In my experience, it is very likely that someone has thyroid deficiency if they have 3 or more of the above symptoms. This can be corroborated by a high TSH and low free T4 and free T3 levels. The other laboratory tests are confirmatory but not required. So when TSH, I'm going to scroll back up here. So when TSH is above 1.5, it basically indicates that the brain is yelling at the thyroid to make more thyroid. And then you can see if that corresponds with lower levels of the free T4 and the free T3. These are the bioactive, bioavailable forms of thyroid, the free fractions. And so usually they corroborate. If they don't, where let's say the TSH looks fine, but the free T4 and the free T3 are low, that indicates that the thyroid is in fact low, but there's something else going on where the brain is not communicating properly with the thyroid. So then here's the conclusion. So yes, I believe I have this cause. So you would mark that off. Go back up to page 2 and mark off thyroid on that. Okay, great. So let's move on to estrogen. So estrogen deficiency. So these symptoms are typically found in women who are older than 45. They can be found in women who are younger if their adrenals and their thyroid are not picking up the slack. A lot of people don't realize that one of the functions of the adrenal gland is to produce sex hormones. So really the difference between someone who goes into menopause and has a problem and the person who doesn't has to do with how robust their adrenals are, and consequently also their thyroid to support the adrenals so that it can take over the production of a lot of the sex hormones. But this is mainly found in women who are older than 45, moving into menopause. So please mark all of the symptoms that you have. So hot flashes, and once again, the asterisk is indicative of the major symptoms that are associated with this deficiency. So hot flashes, vaginal dryness, problems staying asleep, pain with intercourse, and that's usually due to vaginal dryness, hair loss, and this is, if we're working on thyroid and people's hair loss is not improving, then we move on to working on estrogen deficiency. Memory loss. In fact, there's a big correlation between low estrogen and Alzheimer's, early Alzheimer's, so very important component of that. Recurrent bladder infections. This has to do with the fact that there's some muscles on either side of the bladder neck coming out of the bladder, going out into the outside world that are estrogen sensitive. where if you don't have estrogen there, it causes that neck to kink. And oftentimes that's when women will get recurrent bladder infections, or they'll have stress incontinence, where they'll laugh or they'll sneeze, and they will dribble. Depression, joint stiffness, light or absent menses or periods, weight gain, and then of course fatigue. So the tests that you can do are the Fix Your Fatigue blood panel, or the female hormone panel, and that's that blood spot panel. And once again, this is all at the top of this document. You'll see where you can go to get these tests. And then the Dutch sex hormone profile. So this is a urine test, which is especially important if you're taking hormone replacement therapy. So bioidentical hormones, estrogen creams, estrogen tinctures, stuff like that. You're going to want to do the urine test because it is most accurate. And then laboratory data is going to be low estrogen on blood or urine laboratory value. And in my experience, it's very likely that someone has estrogen deficiency if they have 3 or more of the above symptoms, including one of the symptoms with an asterisk. And this can be corroborated by low estrogen levels in blood or urine, but not necessary if symptoms are significant. So if somebody has, 3 of these symptoms and their laboratory tests are fine, I'm still most likely going to treat them for low estrogens because it's going to change the quality of their life, and their body is screaming at me to do something about it. So it's important always to listen to the subjective experience of the individual, of yourself, and remember that if you're experiencing it, even if it's not showing up on the lab, that it still is something that needs to be remedied. So urinary testing is more accurate than blood. Then if you felt like you had this cause, you would mark it off, and then mark it off on page 2 as well. Progesterone deficiency. So this is for women as well. So the main one for postmenopausal women is a hard time falling asleep. So estrogen helps women fall asleep. Progesterone helps women fall asleep. Estrogen helps them stay asleep. And typically we know if it's one of those hormones, if it was significant after menopause. So somebody hit menopause and then all of a sudden they had a hard time falling asleep. We know that it's progesterone deficiency, or they hit menopause and they have a hard time staying asleep, and that's more estrogen deficiency. Then also depression and anxiety. Progesterone is known as the cuddle hormone. So it helps with mood issues. For premenopausal women, symptoms around your menses can include headaches and migraines. So, if you're, sometimes this happens as soon as somebody has their menses, has their period, or sometimes it happens around day 18, 19, 20. That's the point at which progesterone is at its highest. And if you don't have enough progesterone, it changes the ratio between the progesterone and estrogen, which is just below it. And then all of a sudden, progesterone, which is a major anti-inflammatory, all of a sudden, estrogen, which is a pro-inflammatory, all of a sudden you get inflammation. Okay, so that's very important to note in that last week, and those are premenstrual symptoms, that last week before your period. So that's why people also get depression, anxiety, fatigue, and other issues. So the laboratory tests to do, once again, the blood panel, the blood spot test, as well as the urine test. Once again, especially important if you're taking sex hormone replacement therapy. And then the laboratory data is significant if you see low progesterone on the blood test, the blood spot test, or the urine test. And here's the education. In my experience, it's very likely that someone has progesterone deficiency if they are premenopausal, so if they're still having their period, and they have 1 or more of the above symptoms, or if they're postmenopausal and have 1 or more of the above symptoms, including a hard time falling asleep. This can be corroborated by low progesterone levels in urine and blood, but is not necessary if symptoms are significant. And then reminder, urine testing is more accurate than blood. Once again, the conclusion, mark off whichever one is appropriate for you, and if it is a yes, mark it off on page 2 as well. So testosterone deficiency. These symptoms include decreased libido, erectile dysfunction in men, hard time climaxing in women or ejaculating in men, hard time building muscle, poor decision-making ability, diminished physical performance, lack of physical endurance or stamina, and then depression and anxiety in men. Laboratory testing to do, the same as the other ones. The Fix Your Fatigue blood panel, or the female hormone panel for a woman, or the male hormone panel blood spot in men, or the Dutch sex hormone profile, especially if someone is actually taking testosterone. The laboratory data in blood is free testosterone level of less than 2 in women or less than 8 in men, and the total testosterone was less than 82 in women or less than 600 in men. Oftentimes, this will be associated with some elevated cholesterol levels, especially in men, and elevated blood sugar levels. In my experience, it is very likely that someone has testosterone deficiency if they have 2 or more of the above symptoms, or decreased libido. That's really the main one. This can be corroborated by low testosterone levels in urine and blood, but not necessary if symptoms are significant. Urine and blood testing is equivalent in usefulness, but urine is always used when the individual is taking testosterone replacement therapy. And then once again, the conclusion, make your determination and add it to page 2 if it is a yes. Nutrient deficiencies. So now we really switch from most of those we can really determine based off of the subjective experience, the symptoms, whether or not someone has some of those deficiencies, to labs. Okay, so I say I have found that nutrient deficiencies are best identified in laboratory tests, since there is an overlap in symptoms. So this generally means that if someone has these symptoms, it can be caused by a lot of different things. So we really need the labs in order to determine whether or not these are causes that we need to address. So B12 deficiency, fatigue, depression, anxiety, insomnia, neuropathy, so nerve pain or dysfunction, cognitive issues, brain fog, memory loss. So very important in all of these, but plays a role. As you can see, as we're kind of going through this, and as we've talked about, when people come to see me and when they have fatigue, they have 15 nails in the bottom of their foot. And we can pull out the B12 nail, but it's not really going to make that much of a difference until you pull out the B12 nail, the thyroid deficiency nail, the mold nail, the adrenal deficiency nail. So as you're removing these causes, all of a sudden you're getting the nails out of the bottom of the foot and the person starts to feel, but it's this combination of removing all of these causes that really takes people to the next level in their energy and their health. So laboratory tests to do is that Fix Your Fatigue blood panel in blood, or the urine test, the optimal nutrition evaluation, the ONE or ONE test. Now the laboratory data is going to be B12 less than 1500. This is in blood. The homocysteine greater than 7, also in blood. The MCV, or the mean corpuscular volume, this is the size of red blood cells, also in blood. Or MTHFR, heterozygous or homozygous for one or both copies. So this is a gene that utilizes B12 in order to make homocysteine, or to make methionine rather. This is called methylation. And this pathway, oftentimes if you have these genes, you need more B12 and folate and some of these intermediates in order to help with your detoxification process. So this can be a big problem for people. So this is definitely something to look at. Now, the optimal nutritional evaluation will just have it as a urine value that'll say high need B12, or basically severe deficiency of B12. So in my experience, it is very likely that someone has B12 deficiency if they have one or more of the above symptoms and low B12, high homocysteine, high MCV per the above values. If someone has MTHFR gene or other genes associated with methylation, they should receive supplemental B12 as well. But pretty much all the time, if you have a SNP or a single nucleotide polymorphism, or basically a problem with one of these genes, you're also going to have problems with these as well. And when we go more into the course, we're going to talk more in detail about some of these pathways so that you can understand how homocysteine plays a role. And what's very interesting is that homocysteine, when it's above 7, increases risk for heart attack, heart disease, stroke, and Alzheimer's. And so you can see how important B12 is in playing a role in those things, because it will lower homocysteine. And then you come down here to conclusion, mark off your conclusion, and if it's a yes, add it to page 2. So here's folate, vitamin B9 deficiency. So these are all symptoms that you're going to see are pretty general, which is why it's so important to get the lab tests. So memory loss, headaches, decreased libido, detoxification problems, that's the MTHFR, which also relies on folate in addition to B12. Neuropathy, so nerve pain and dysfunction. Chemical sensitivity, poor immune function, frequently getting sick, fatigue, constipation, bloating, developmental problems during pregnancy and infancy, anemia, canker sores in the mouth, swollen tongue, irritability, premature hair graying, and pale skin. So it's quite a list that also have multiple causes. So then laboratory tests to do, the blood panel or the urine test, the one test. And then here's just some information for genetic testing that you can use. The 23andMe can give you that information, and we'll get more into that as we dive into that chapter as well. Because you basically take the information, you put it into a different website that allows you then to do some more interpretation. So the laboratory data is the red blood cell folate in blood, less than 1500 is considered significant. Homocysteine, greater than 7, mean corpuscular volume greater than 96, and then the MTHFR gene as well. So in my experience, it is very likely that someone has a folate deficiency if they have 2 or more of the above symptoms, or low folate on a blood or urine test. If someone has the MTHFR gene or other genes associated with methylation and folate metabolism, they should receive supplemental folate as well. Then you mark yes or no. And then moving into vitamin D deficiency, fatigue, anxiety and depression, seasonal mood changes, so seasonal affective disorder, getting more depression during the winter, chronic pain, and fibromyalgia. The test that we have for this is the blood panel test, and we want levels to be above 60. So what's considered significant and abnormal is this 25-hydroxy vitamin D less than 60. And the education is, in my experience, it is very likely that someone has vitamin D deficiency if they have 1 or more of the above symptoms and low vitamin D on blood lab testing. And then once again, make your determination based off the labs and add to page 2 if it is significant. Magnesium deficiency. So symptoms, constipation, muscle pain, muscle spasms, muscle cramping, insomnia, adrenal deficiency, and fatigue. So magnesium plays a role in about 550 different enzymatic reactions in the body. So incredibly important and incredibly supportive and very important part of addressing fatigue. So you can test in the blood panel, or you can test in the one urine test. And then the laboratory data in blood, it's going to look at less than 2.3 is considered abnormal. And on the urine test, it's borderline or called high need for magnesium on the urine tests. The other thing that I'm going to do too is that with each of these tests that I'm recommending, I'm going to have videos on how to interpret those tests. So when you get them back, you can go directly there and you can get that data. And then in my experience, it's very likely that someone has a magnesium deficiency if they have 2 or more of the above symptoms and low magnesium on a blood or urine test. So magnesium is one of those that you can do subjectively sometimes if somebody has muscle cramps, if they have a hard time sleeping, if they have constipation. Oftentimes we will give people magnesium without the laboratory tests, but the laboratory tests definitely help. And then the conclusion, make your determination, and if it's a yes, add it to page 2. So iron deficiency. So anemia, fatigue, pale or yellowing skin, shortness of breath, heart palpitations, muscle weakness, appetite changes, sleep problems, cough, memory and cognitive impairment, and mood changes. So you've noticed sleep problems on here numerous times with numerous different things. You guys have probably heard me talk before about sleep, but I get more people to sleep at night by giving them adrenals, thyroid, iron, B12 in the morning than I do by giving them anything at night, because sleep is a circadian rhythm issue. And we're going to get into sleep in just a little bit. So then laboratory test to do is the blood panel. That's the only test that's going to give you this information. And then here's how to interpret it. If you've got a total iron binding capacity or a TIBC of greater than 350, if you have a ferritin of less than 40, if you have a mean corpuscular volume of less than 90, those are all significant. And so in my experience, it is very likely that someone has an iron deficiency if they have 2 or more of the above symptoms and the combination of the low ferritin plus the low MCV plus the high TIBC on a blood test. So you generally need to have all 3 of these. Then make your conclusion. Next up is sleep deficiency. So this is basically if you have a hard time falling asleep where it takes you longer than 30 minutes, if you have a hard time staying asleep, basically you're waking during the night and you're not able to fall back asleep. If you are not getting 8 or more hours of uninterrupted sleep per night, so whether you're being woken by a child, by an animal, or you're just waking up on your own, you snore or stop breathing, this should be breathing, stop breathing at some point while sleeping, you are napping during the day, you use technology for 1 hour prior to bedtime, so oftentimes that can disrupt your sleep. You're not using a blue light blocker on your phone, computer, or tablet, which can interrupt with your pineal gland and its ability to produce the hormones needed for sleep, and you don't feel rested in the morning. So you also, in terms of the laboratory tests, you can run the blood panel test, or you can run the male-female hormone panel and the one urine test. So you need both of those to compete with the data that you're going to get from this test. But basically what those are going to show you are the things that I talked about according to sleep. So B12, thyroid, adrenals, iron. So basically all of those things are very important to assess when we're looking at what is the cause of a sleep deficiency or a sleep problem. And then an abnormal sleep study to determine whether somebody is snoring or they've got some sort of sleep pathology. And then in my experience, it is very likely that someone has a sleep deficiency if they have 2 or more of the symptoms or signs above. Sleep deficiency are mainly the cause of a circadian rhythm issue. Fixing the laboratory abnormalities associated with these other deficiencies will often remedy the sleep deficiency. So once again, make your conclusion. And then water deficiency. So if you do not drink half of your body weight in ounces, for example, if you weigh 120 pounds, you're not drinking 60 ounces of water per day. So this is basically, if you're measuring yourself in kilograms, it's about the same number of kilograms. And then when you urinate, your urine is always yellow even after drinking copious amounts of water. So this is indicating dehydration. So we stick this in the deficiency section and we call it water deficiency, but it's basically dehydration. And then you can corroborate this with a blood panel test, the BUN or the blood urea nitrogen and the creatinine, which is basically if the ratio is 20:1 or greater, it's indicating dehydration. And then in my experience, it's very likely that someone has a water deficiency or dehydration if they have 1 or more of the above symptoms. The laboratory data is confirmatory but not necessary. So you definitely need to be drinking that much water. And then if you are finding that, and sometimes your supplements will cause your urine to be yellow, but if you haven't had supplements for an hour or 2 and you're still urinating and it's still concentrated, then you're living in a dehydrated state. So go ahead and mark off the conclusion. So then good food deficiency. So if you're not consuming whole fruits and vegetables, if you consume lots of grains and processed foods, if less than 80% of the food you consume is organic, and if you consume dairy, gluten, corn, sugar, or alcohol every 1 to 2 days, then you've got a good food deficiency. You're not getting the food that you need. In fact, you're getting a lot of toxic foods. So what we're going to do for testing here is the Great Plains Tox Lab, which is going to look for chemical toxicities, including pesticides. And then I have also the information here on how to provoke it, how to use liposomal glutathione to push the chemicals out of its hiding places so that then you collect it in the urine with this test, and we can make sure that we get an accurate sample. And then the glyphosate, which is basically the active component in Roundup. So we're looking for pesticides, the pesticide toxicity for food toxicity. And this also needs to be provoked with the liposomal glutathione. And then if the urine test shows pesticides, that is significant. And then I say it's my experience and very likely that if someone has a good food, someone has a good food deficiency or food toxicity if they have 2 or more of the above symptoms. So the labs can definitely be helpful, but if you're not consuming a lot of your stuff organic, there's been studies to show that it just comes out in the urine. They've done before and after testing, taking kids, and they were actually looking at behaviors, and they found that in children who were not eating an organic diet, they found pesticides in their urine, and their behaviors were not supportive of the environment that they were in, so they were poorly behaved. And then when they switched to organic for 3 months, they found that there was no pesticides in the urine and the kids were much better behaved. So very important, but you can tell based off signs and symptoms, and then you're complemented with the laboratory testing. So and then neurotransmitter deficiency. So please mark all the symptoms that you have. And so this is depression, sleep problems, lack of interest in things you once found pleasurable, lack of appetite, suicidal thoughts. So those are mainly like serotonin deficiencies. Anxiety is more like GABA, gamma-aminobutyric acid. Memory loss, focus issues, fatigue, and hard time managing stress, that can be more dopamine. Low self-esteem, easily self-critical and guilty, perfectionist, easily irritable, shy or fearful. Exercise helps your mood. A lot of those are serotonin as well. They can also be norepinephrine or epinephrine. So you can do the urine neurotransmitter test, which is going to help discern which of those neurotransmitters might be off in you. And then the laboratory data is significant if it's indicative of any of those neurotransmitters being low. And in my experience, it's very likely that someone has a neurotransmitter deficiency if they have 2 or more of the above symptoms and low levels of the neurotransmitter on the urine test. Now, oftentimes we can, if I assume that someone has low serotonin symptoms, we can give them some serotonin precursors, and if they feel better, we know we're on the right track. But doing the testing is incredibly helpful. Once again, come to your conclusion, mark it off, and if it's a yes, put it on page 2. And then I believe this is the last one in the deficiency section. So the main movement I get is from walking around my house to my car and around work. So that's basically the only sign or symptom that I've put on here. Or basically, you have an exercise or a movement deficiency if that's all of the movement that you're getting. Now, of course, if you've got fatigue, and if your fatigue is causing your lack of exercise, then don't start exercising until your energy improves to up to about a 6 out of 10. So exercise, as we talked about initially, can be stressful on the body, and so you want to make sure that you are in a place where your body can tolerate it. Once again, mark it yes or no with the caveat of if you've got fatigue, that this isn't going to be something you're going to want to work on right now. And then if it's a yes, add it to page 2. Okay, so in the next video, we're going to talk about toxicities.